So I can't believe that we've worked together in Bolton, or we've both been in Bolton for like over 40 years between us. Only met each other a couple of weeks ago.
No, can I?
But it's been really good to meet you, Sue. We realised that we have got lots of things that we're both interested in. I know you're really keen to talk to AHPs in Bolton about the Long Term Plan, how it relates to us and how we can really use it as a vehicle moving forward.
I think it's just a great opportunity for all AHPs. I go back to when I started in my role in Bolton as a consultant physio 16 years ago.
Right.
That was on the back of the NHS plan at that time.
Yeah.
That was the first time that consultant AHPs were talked about. And that's where advanced practice with AHPs really took off.
Yeah.
There was just such a drive for change. Innovation and creativity were embraced, and we were taking on roles to take stress off the medical profession so that they could do the work that they needed to do. We could take on other roles.
Does it feel like we're in a time like that a bit
now?
So we can't read it for people, but I think we wanted to pick out some of the key things that perhaps people could be looking out for that were in the document. So what did you particularly think was relevant and interesting for AHPs in the document?
So I think we've got a lot to give to the population health aspect of things.
Yes.
I think we need to begin to look more at the front end. So not only where disease process starts, and it talks in the NHS plan about early diagnosis. That's where some of my research comes in. But also before that, what about predicting what could happen? We've got a big role to play there. Should we even start in schools giving health messages? And if you look at the skills across AHP professions, we've got lots to give. To not only be firefighting what's coming in today, but let's look at not even the next 10 years, but the next 20, the next 30. Today, we can have an influence on that. That's really exciting.
I think what it does is it talks about how we need to work with others, so the integration across the community, so it really does focus on the sort of a new community model and how you work with voluntary sector and the council, and I think we're really strong at that. I think we're really strong at looking at where we've got good links and good and we're good at collaborating and seeing like new opportunities. We need to just take this one really. Yeah,
definitely. In Bolton, we need to look at the health inequalities, which is also mentioned in the NHS plan. So it's quite amazing to think that our average life expectancy falls below the average life expectancy in general of England. And even within a mile radius, we could have a 10-year difference in life expectancy.
It's quite startling, isn't it, really?
Shocking. But we can do something about that. And that's exciting. So looking at things like obesity, alcohol, smoking, things that are mentioned in the NHS plan, air quality. Also things that aren't mentioned, so in my field, things like osteoporosis, looking at prevention. So we can see people at risk even in the 20s and 30s. If you look at every contact counts, those patients might have come to, let's say, a first contact practitioner in a GP practice for something else. Might be just a general simple mechanical backache, but you can see that they're at risk of problems 20 years, 30 years down the line, when they may be presenting to a healthcare setting with a frailty fracture, fractured neck of femur.
And it's looking at digital solutions, technological solutions, so somebody might have a really good idea about a way that a patient can manage their own health using a digital solution. It's taking those ideas that individuals who work with us might have and seeing what we can grow.
And I think you know, we can't anticipate what that digital health solutions will look like in 20, 30 years time. That's also so exciting. When we started working, who would have thought that apps were part of some of the solutions? But there's all sorts, you know, that we can do.
There is. It specifically talks about stroke, and it specifically talks about new ways of providing rehab for stroke and cardiovascular conditions. Some of the areas that we're developing here at the moment around heart failure will really fit in with this plan as well.
It's fantastic opportunities.
So it's around us perhaps being creative about new roles. So you saying you're one of the first consultant physios in the country, we still don't have in Bolton anymore. So it's looking at how we can perhaps develop new roles, and that's at that sort of specialist end, but also with our support staff and about how we work better and with our support staff as well. So
and the voluntary sector,
exactly,
embracing patients' ideas. It's such an exciting time to work in the NHS, such an exciting time to work in Bolton.